So how did we prepare the physical HIV clinic for the lockdown? So before anything else, ito yung usual na services na ino-offer ng SHIP. If you can see that we run the gamut of services, lahat ng pwedeng magawa for prevention and HIV. The lockdown really would have affected us greatly. Marami sa mga services namin ang maaaring hindi matuloy or maapektuhan. So, ito ang setup ng SHIP clinic before. You can see it's a very small clinic. Maliit lang siya. Napakaliit. It is made up of 3 rooms for physicians to see patients. And if you can look at our waiting area, ang pwede lang magkasya dyan ay siguro maximum ay 1, 2, 3, 4, 5. Pinalta namin ito, naging yan. So, tapos if you can see, so we cater about mga 900 PLHIVs, plus meron pa kaming mga naka-PrEP, naka-PEP, mag-walk-in for HIV testing. So you can imagine, for clinic hours na 2 to 7, which is only 5 hours, 6 times a week, so may day off kami ng Thursday, kailangan medyo maayos yung appointment scheduling namin. So knowing na we were starting with a very small, tiny area, we had to make sure na yung appointment system namin medyo maayos na before namin siya para hindi magkaroon ng any problem during the consultations. So this is a blurred picture of what a weekly calendar looks like. Ihilang ang pahinga siguro during a normal clinic day, no? So for 3 rooms, we have 3 healthcare providers. Meron tayong nurse, case manager, and physician at any time of day. So therefore, we can accommodate 3 patients per hour. On a normal day, pre-ECQ, each patient gets 30 minutes with the healthcare provider for blood draws, refills, vaccines, and a short case management. Pero sa mga pasyente na kailangan ng first meeting with the doctor, like initiation ng ARVs or yung kanilang annual consult of kamustahan, meron silang 1 hour. So block time is achieved through appointment setting and yung na-mention kanina ni Dr. Jello, yung Connect for Life. Kasi yung Connect for Life is a tech service or a call service that reminds our patients 3 days before and 1 day before na hello, you are set to have your appointment at SHIP at this time on this day. Para meron silang time to prepare or to call us to reschedule para hindi nila makalimutan yung kanilang appointment. So, okay, next. So, nung January, end of January, narinig na natin na nagkaroon na ng first few cases ng COVID-19 sa Pilipinas and to prepare for the eventual rise of the cases kasi makita natin na sa China and sa Italy ang trend ay hindi na natin kailangan pang hintayin na mangyari ito locally. So as early as late January, nag-message na kami sa lahat ng pasyente. So I created a love letter to each patient which was saved in each of their Dropbox folders. So meron kaming Dropbox folders kung saan nandun yung mga laboratory results ng mga patients and important memos na nakashare sa clinic at sa kanila. So meron akong love letter. So ang sabi dito ay, so basically I'm informing them of what COVID is and how to keep themselves protected. So tinuruan ko kung paano mag-cover ng cough, kung paano mag-hand hygiene, how to do social distancing, how to keep their immunity strong by eating well, how to use a mask properly, and then ito na ang important. So bilang mga pasyente, ano yung mga ang important is if you are so the clinic will play its part to limit unnecessary visits. So 'di ba sa HIV kasi naging practice natin na every 3 months kailangan mo magpunta para mag-refill, para tas meron kang every year anniversary, parang talagang schedule siya, routine schedule siya by hook or by crook, kailangan mo magawa kasi kailangan i-monitor yung health mo. Pero ang sinabi natin is we will play its part to limit unnecessary visits. If you are clinically well, stable, and without need to see me for a consult, we can do our meeting online. And marami na sa mga pasyente ang naka-experience nito. Labs, if not urgent, may be postponed. We can facilitate refills via Grab Express, Lala Move, LBC, or pick up sa clinic na super fast lang. So if your appointment is coming up and you want to defer, meaning i-cancel ang personal clinic visit, let us know. Pero if they want to visit, then that's their preference. Nila yung i-balance nila yung risk and benefit of actual clinic visit. So importantly, we did not close the clinic the whole time of the quarantine period kahit na enhanced siya kasi essential service kami. Kailangan namin mag-provide ng mga gamot sa pasyente, kailangan hindi maputol ang serbisyo. Pero kung pwedeng telemedicine tayo. Tapos binigay namin yung mga contact details para easily ma-reach kami ng mga pasyente. So January 31 yun, ano? So no March 12, nag-announce yung gobyerno, Metro Manila will be placed on lockdown. So we had to think of ways to adjust even further. Ang naisip namin is, ang ship kaya, no? Kaya namin na bigyan ng gamot yung sarili naming mga pasyente. Pero naisip ko, may mga pasyente na nag-reach out sa amin from other places na sabi nila na either na-lock sila sa Manila, they can't go to their hub, or they have no way of going out. So buti na lang, the Department of Health thought of these guidelines on service delivery for lang, dinasseminate na sa amin kasi important na magawa na namin yung kailangan gawin for the patients agad-agad. So even for foreign national visitors or short-term migrants or long-term migrants, ibibigay namin yung gamot nila. So ang bottom line is walang gamot na dapat na matigil. Okay? So yan. So kailangan namin bigyan lahat ng PHIV no matter where their treatment hub is. And yung DOH na lang ang mag-coordinate with us to replace our stocks. So naging maganda ang communication namin sa at least DOH NCR. So meron kaming chat room, group chat with the hospitals and the primary care units of NCR sa Messenger. Kasi alam mo naman, ditong pinakamalakas nating gamitin kung hindi Viber ay Facebook Messenger. So doon, nagchat-chat kami na kunyari, you want to, meron kami nakasalamuha na pasyente galing sa, for example, Santa Ana Hospital. I-confirm lang namin sa treatment officer nila na ito nga ay pasyente nila at ito yung gamot nila. So, from any place in NCR and even outside, nakakakuha kami ng mga pasyente na nanghihingi ng gamot. So, in total, nakapag-deliver ang NCR group ng, ay naku, nawala. Anyway, it's 2,095 refills for transient clients from all regions. So imagine 2,095 PLHIV na nangailangan ng gamot outside their hubs ang nakatanggap ng gamot nila because of the advice the HIV office ng DOH. So maliban pa doon sa mga treatment hubs na nagsa-service, meron pang nabanggit nga kanina ng mga earlier speakers natin, ang Oplan Arvayanihan, which is an initiative of TLF Share and Red Whistle and Save Sexy, and also of eventually DOH. So ito naman, nagsimula ito sa mga volunteers lang sa Rizal area. Mga private volunteers na willing silang mag-deliver using their cars or their motors ng gamot sa PLHIVs in that area. Tapos nag-expand siya to the whole NCR and Metro Manila area, wherever there is angkas. So eventually naging funded by the HIV program yung drivers ng angkas to deliver meds, especially to those na hindi afford ang private courier service para lahat makakuha ng gamot. Okay. So move na tayo ngayon sa new announcement ng May 11, yung ating modified enhanced community quarantine. So ang naisip namin ng time na to, many offices will now open. So including as well. So dapat maging open na kami sa physical presence ng mga pasyente sa clinic. So how do we prepare for that? So sa office natin, sa SHIP Clinic, nag-provide kami ng manual of operations for opening the clinic. So meron kaming prevention, process, and mitigation. So this is guided by guidelines established by the DOH, recommended by the PSMID, kung ano dapat ang itsura ng isang workplace, also a healthcare facility when you try to open it up. So important yung air exchange. So kailangan kong isipin, ilan ba yung available namin na air exchange sa clinic? Meron ba kaming mga exhaust fan? Kailangan ko ba magbukas ng pintuan kasi wala kaming bintana, naka-aircon kami. Kailangan ko may open yung isang door para mag-open yung para pumasok yung hangin. Tapos kailangan mag-provide din kami ng PPEs sa lahat ng staff namin. We have to protect our staff as well. So, syempre, we need to also determine what encounters demand certain PPEs. So, pinakita namin doon na ito yung pwedeng gawin: cloth mask over surgical mask and disposed cloth mask after each patient use, or surgical mask and face shield, eyewear, etc. Tapos, for no contact close or procedure, enough na yung face mask or eye protection. Kasi iba naman yung level of exposure ng healthcare provider na in contact with a patient sa receptionist or cashier. Tapos miski ang handling money, dapat may tips kayo doon. As often as possible, sana cashless encounters. Pero of course, we realize na hindi lahat ng tao may access to cashless encounters. Cleaning of the clinic is also important. Physical distancing, ilan ang pwedeng tao sa isang kwarto at a time, and paano kung ang staff namin ay nagkaroon ng symptoms of COVID? Anong gagawin namin? So lahat yan, kasama sa aming manual of opening the clinic during COVID. So ngayon, ito yung naging itsura ng aming clinic. Kung kanina, dikit-dikit yung mga silya, ngayon, we try our best na at least 1 meter away from each other, yung mga distansya ng mga pasyente, and everybody should wear a face mask. Ang aming staff din, nakapag-provide kami ng PPE with proper instructions on how to use them during each encounter. Tapos, maximize din namin yung na-mention kanina na RTC, which is ART, delivery, and electronic consultation. So, actually, ilang years na namin ginagamit ito, tulad ng sinabi ni Jello. Nung una, we were using it because napaka-traffic sa Manila, okay? Yun yung aming principle dati. Ubos ang panahon ng pasyente sa traffic, papunta sa clinic, nasasayang ang oras nila. Pwede naman siyang gawing online, nakakatipid pa sila, at available ang option. So, ito yung aming package, no? Piniction to ng isang nakatanggap ng package namin. Hindi ibig sabihin na walang personal visit sa clinic ay hindi na tayo mamimigay ng mga commodities na tinatawag natin. So, meron kaming lubes and condoms na binibigay along with the medication. Tapos, nag-donate din yung SHIP Foundation sa clinic ng cloth masks na gawa ng isang mabuting loob, no? So sa bawat pakete ng gamot, may mga goodies tayong pinapamigay because we want them to be protected both from STDs as well as COVID. So ngayon, yan yung mga pinakita naming ways kung paano namin sinubukang i-prevent o mag-function properly during the COVID epidemic. So without question, there are still potential issues, no, for HIV services as we move forward. Una, ang tanong, tumuloy ba ang HIV testing during COVID? That is the question. So, hindi dahil nag-lockdown ay lahat ng tao ay tumigil sa pakikipag-sex. So, they might have still been at time of lockdown. Meron ba tayong na-miss na mga pasyente? So usually, ang HIV testing sa atin is a face-to-face encounter. So kita natin there are 2 pairs of hands in this picture. So ngayon na bawal ang physical contact, paano ka mag-HIV test? So marami sa ating mga chow at sa mga case managers natin ay facility-based. Bihira sa mga volunteers natin ang lumalabas at sumusuyod ng community tulad dati. So ano nang nangyari sa HIV testing natin? So that's the question. At hindi lahat ng tao ay may access na pumunta sa facility para magpa-test kasi wala tayong public transportation. So that's one conversation that we should have. Second, paano ang pamimigay ng condom? So hindi ko sure kung namimigay din tayo ng condom with every ARV that we send. Pero sa mga tao na hindi makalabas at bumili ng condom sa bilihan, next, paano yung mga nagka-STD pero walang transportation papuntang clinic? Paano sila makakapag-receive ng gamot? Usually, ang gamot sa STD ay injection plus tablet. So, ibig sabihin, kailangan ma-administer ito sa health facility. Paano kung malayo sila sa facility? Kailangan ba nila maglakad ng 3 oras papunta sa kanyang clinic para magpatusok ng theft drive? Next, paano yung mga naka-PrEP? Di ba ang PrEP, kailangan at certain points in time, sila ay nag-HIV test, nagka-creatinine or nag-STD test or Hep B test before sila bigyan ng refill nila. So, paano yun? They can't do their labs on time kasi sarado yung mga labs. Or, may tao is beside the hospital wherein they will be exposed to COVID unnecessarily. Does that mean they will stop their PrEP? And if they stop their PrEP, does that mean they are at risk for contracting HIV? Next, sex workers can't get their condoms. Drug users can't get their new syringes. Does that mean that they are going to have more risky behavior and therefore expose themselves to further harm? Kasi wala tayong harm reduction services na easily nilang makuha. So according to the press statement given by UNAIDS, physical distancing restrictions have created significant challenges for those needing to access essential services, creating an increased burden on the community organizations which are at the center of service delivery. So aminin natin, sobra tayong dependent sa ating mga volunteers, no? To actually provide our support. Pero ngayon na sinasabihan ng mga volunteers na ingat muna kayo sa bahay, protect yourself. Paano yung mga delivery natin? Okay, so the UNAIDS naman have the following recommendations. So, ang sabi nila that COVID-19 committees at the national and district levels should include the HIV community-led healthcare services in the list of essential service providers and treat them as equivalent to healthcare providers. You should designate physical distancing restrictions and policies in ways that allow community-led services to continue operating safely. Provide special authorization to relevant community-led service providers to move freely with appropriate PPEs to deliver the services when ensure that community works and groups be provided with personal training in order to protect themselves and their clients in course of service delivery. Take urgent measures to ensure the security and expansion of existing funding for community-led organizations so that they can continue to provide services. So, yung mga ibang chow natin, wala yata silang hazard pay, so they cannot continue to provide their services. Ensure inclusive and transparent governance of COVID-19 responses with decision-making bodies, representatives of community-led organizations, including those focused on gender, equity, and human rights, to ensure that COVID-19 policies are designated to support the range of service provision and activities necessary for an effective and equitable response. So, bottom line is, let's include our community-led HIV services sa tinatawag nating essential service providers and frontliners. And let's give them the support that they deserve. So yung last slide ko, why don't we try something else? So let's not just limit ourselves to what's available. So sa ibang bansa, sa mga inaccessible areas, drones actually deliver vaccines and HIV medications, especially in Africa. So Africa, isipin mo, malawak siya na land-based. Tayo, ilan sa isla natin ang hiwa-hiwalay, no? Problema sa atin talaga ang geography, and I think we have to look for solutions. If they say that every province has a person living with HIV, even the far-flung islands will have someone in need of meds. Itong taong bang to ay titigil na lang kasi walang aabot na courier service sa kanila. Nagkaroon kami ng kaso na kailangan namin i-recruit ang Coast Guard ng bansa upang inusing bangka o barko papunta sa napakalayong isla para sa isang tao. Eh yung gamot niya, good for ilan yun? 1 month? So next month, magko-Coast Guard na naman tayo. So yun. So we have to think outside the box kasi if we don't provide universal access, patients will not be able to take their meds. We will have mutation of the virus and encounter drug resistance. At this point in time, where laboratory is limited, we don't have the means to test also for drug resistance. So let's help keep them on their meds. So yun, I think that's my last slide. Thank you very much.